So here's the problem. Most people are told their thyroid is fine when it's actually anything but that. And that's because the conventional medicine approach basically uses an outdated map to read a complex system.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Hey, Health Decoded listeners. Dr. Alessi here. Let me ask you a serious question. Are you tired of waiting until something goes wrong to finally see a doctor? At Alessi Functional Health, we take a different approach, the right approach. We believe true healthcare isn't about chasing symptoms. It's about preventing them in the first place. That's why we created the Alessi Total Care Program. This is a functional medicine-based membership that gives you proactive, personalized care year-round. You'll get access to comprehensive blood work and functional testing, custom doctor-grade nutraceuticals, deep discounts on labs, protocols, and follow-ups, as well as 24/7 direct access to your doctor, not just a 10-minute checkup that ends with another prescription. And here's the best part. As a Health Decoded listener, you'll get your first 3 months completely free when you sign up for an annual membership. That's on top of hundreds in savings already built into the program. This is your chance to take responsibility for your health and join a movement that's redefining what primary care should look like. Head on over to alessifunctionalhealth.com, click on our services tab, and go to Total Care. Learn more about this program and claim your exclusive podcast listener offer. Your health is your greatest asset. Let's protect it proactively. Welcome back to another episode of Health Decoded. I am your host, Dr. Alessi. Very excited to have you with us today and very excited to talk about this topic because this is something that I struggled with in the past and actually had to heal and overcome to get back to a state of health. And so what we're talking about today is thyroid dysfunction and ultimately, how we take a different approach in functional medicine to not just cover up the symptoms with medicine and get you by, but to actually heal and restore health to the thyroid and ultimately the systems that are connected, because the thyroid does not operate in isolation, just like every other system in our body. And I hope by now with this show, you're starting to understand that concept that we are not a heart connected to a stomach connected to a liver, right? We're a unit and we're a system, and all these systems have to work together. And when one is dysfunctional or not operating well, it can then cause downstream effects to other areas. So we have to look at everything to see how the system is running. Great example of that would be like your car. If you had a gear that was malfunctioning, or I'm not a big car guy, so I apologize if I butcher some of this, but if you have a piece of the engine that's not operating correctly, it's going to then affect other parts, right? And so it's the same concept within our bodies. We can't just look at one thing and isolate that. We have to look at the entire system. So, if you've ever been told that your thyroid levels are normal, but you have symptoms such as stubborn weight gain, brain fog, depression, maybe some type of mental illness or cognitive dysfunction, it's not that you're crazy and then it's all in your head, right? Which a lot of people said they've been told that by their conventional doctors. It's likely that you're getting misdiagnosed or even undiagnosed in this situation. And so here's a quick kind of preview of what we're going to talk about today. What is your thyroid and what it actually does? We're going to talk about some of the symptoms that most doctors are going to overlook or, ignore, pass off. What tests is your primary care not running that you need to look at? And then how do you actually fix the root cause of thyroid dysfunction or thyroid imbalance? And so let's just get right into it. Again, thank you for joining us. I hope this provides you with some value. If you know somebody who struggles with thyroid conditions, has been back and forth with other docs and not getting answers, please share this with them. I hope it can provide some insight. So let's just start with what the thyroid actually is, why it's so critical, and why it's so important, right? Most people think of it just as a metabolism gland, but in functional medicine, we know it's much more than that. It's basically the command center for your energy, your weight, your brain function, and even your fertility. Now, I'll get more into this. So essentially what the thyroid is, it's a small butterfly-shaped gland located at the base of your neck in front of your trachea. Now, it's small, but despite the small size, it actually has massive control over your body's systems. It produces hormones that regulate metabolism, heart rate, temperature, mood, and energy. It's like a metabolic switch. And so here's a great research insight. According to a review in Physiological Reviews, the journal, the thyroid hormones influence virtually every organ system and are crucial for development, thermoregulation, and homeostasis. And so when the thyroid is off, you better believe everything else is going to be off. And so let's explore how it works, right? This is what we call the HPT axis, or the hypothalamic pituitary thyroid axis. That's multiple glands working together, telling each other things, different signals telling each other what to do. So the first, and it's a feedback loop. So when one is elevated, it's going to downregulate the next. When one is low, it's going to upregulate the next, and they talk to each other. So first thing that happens, the hypothalamus releases what's called TRH, which is thyrotropin releasing hormone. TRH then signals your pituitary gland to release TSH, thyroid stimulating hormone. So oddly, thyroid stimulating hormone is not produced by the thyroid. It's produced by the pituitary gland. That TSH then stimulates your thyroid gland to produce T4, which is thyroxine, and T3, which is triiodothyronine. T4 is mostly an inactive signaler. And so what it does, your body then has to convert T4 into T3, which is the active thyroid hormone. This is the active form that's primarily found in the liver and the gut. Now, elevated levels of T3 are going to signal back that feedback loop to the hypothalamus and pituitary gland to reduce TRH and TSH. We call that a negative feedback loop. So it's important because this maintains balance. So over 90% of thyroid hormone produced by the thyroid is T4, but T3 is 3 to 5 times more biologically active. And that's important because these are things that your doc is not looking at or taking into account. And so let's talk about these hormones a little bit more and what to understand about them. So again, TSH is that thyroid stimulating hormone. It's basically a signal from your pituitary to your thyroid. And why this is important is because high TSH, which often means underactive thyroid, but by itself doesn't tell the full story. Now, again, that's what conventional medicine is going to look at. They're going to look at TSH, and if it's in range, they're going to say you're good, but it's missing pieces, right? So next on the list, T4. This is the inactive form, must be converted into T3 to be used by the cells. T3, which is the active thyroid hormone, this is what actually regulates your metabolism, your energy, heart rate and temperature, and even brain function. Now, there's another one, reverse T3. This is basically the inactive, or what we call like the brakes version of T3. And so it competes with T3 for cell receptor sites. This is often elevated in stress, inflammation, or even chronic illness. So this is a great marker to look at. And then there's thyroid binding globulin, or TBG. It is basically a carrier protein that transports those thyroid hormones into the blood. And so if TBG is too high or too low, your free hormone availability is impaired. This can be influenced by things like estrogen dominance, liver dysfunction, and even inflammation. So again, these are markers to look at that can signal other issues down the line. Reverse T3 acts as a competitive inhibitor at the T3 receptor site, and it increases under stress, illness, or even heavy toxic burden. So why does this matter, right? Why does this matter clinically? Because conventional medicine often only tests the TSH and T4. Sometimes this doesn't show that there's a conversion issue, or if there's any autoimmune activity, or even if there's T3 resistance. Whereas with functional medicine, we use a complete thyroid panel to understand what's actually happening at a deeper level. Because you can have normal TSH and still have thyroid symptoms if your body can't convert the T4 to T3, or if the reverse T3 is blocking that conversion. And so the connection between thyroid, brain, mood, fertility, what we see is in cognitive function, the T3 is actually what regulates neurogenesis. That's the growth of new neurons, and the synaptic plasticity, or basically how our neurons are able to form new connections, and the balance between the neurotransmitters. That is controlled by that T3 hormone. A lot of people don't know that. With our mood, hypothyroidism is actually linked and actually shown to be a significant player in depression, anxiety, and even poor memory. If the thyroid's not functioning, that synergy is going to be missed. And then with fertility, thyroid hormones regulate menstrual cycles and ovulation. Even subclinical hypothyroidism can be linked to miscarriage and infertility. And so, when we talk about the functional medicine paradigm, the thyroid doesn't work in isolation. I already said this. It's connected to your brain, your liver, your gut, and even your immune system. And so it's very critical because the liver is very critical for that T4 to T3 conversion. The gut microbiome is going to talk and influence hormone metabolism and absorption, and even your immune system. Now, particularly with things like autoimmunity. So autoimmune thyroiditis, or Hashimoto's, is often related to gut dysfunction or things like leaky gut. These can be significant players. And so about 70 to 80% of peripheral T4 to T3 conversion happens in your liver and your GI tract, or your gut. So if you have things like SIBO, gut dysbiosis, leaky gut, this will impair that process and then can cause that obviously to be dysfunctional upstream. So that's why it's important we don't just look at the thyroid. So with functional medicine, if we truly want to help someone heal their thyroid, we need to zoom out, not just look at one hormone, not even just look at that thyroid itself, but look at what other systems may have an imbalance. And that's where we can uncover things. Now, let's step into a different kind of approach here, or a different topic, and let's talk about what symptoms to look for. And if you have these symptoms, it's time to investigate, right? We always talk about not ignoring symptoms. They're check engine lights. They're giving you some type of information that something is dysfunctional. So let's talk symptoms. This is where the real suffering lives, right? Because we often are dismissed, or patients have come to me and they've said, man, all my labs are normal. Will you look at this? And I say, okay, I have a picture here. I have a little bit of information. I need much more than this. And that's where the discrepancy is between conventional approach and the functional approach. So with low thyroid or hypothyroid, these are some symptoms that are very common. And so when your thyroid hormone is deficient or being poorly utilized, basically think of it like your body is slowing down. This is the most common type of thyroid dysfunction that we see. So some common symptoms are going to be things like fatigue. You have low cellular energy production, weight gain, or the inability to lose weight because your metabolism has been slowed down, intolerance to cold because your thyroid gland regulates your temperature, dry skin, brittle nails, hair thinning or hair loss due to a slowed protein turnover, constipation because your gut motility is reduced, depression, brain fog, slow thinking, irregular or heavy periods for women because hormone imbalance and estrogen dominance are in effect, infertility or low libido, and then slow heart rate or reduced cardiac output. So a study in the Journal of Clinical Endocrinology and Metabolism showed hypothyroid patients had significantly higher rates of cognitive dysfunction, menstrual irregularities, and fatigue. Now that's low thyroid, that's hypothyroid. Let's talk about what high thyroid or hyperthyroid symptoms could look like. So when the thyroid is overactive, it's often overstimulating the body, and this can feel like you're running on fumes. So some things we would see would be like anxiety, irritability, restlessness. People can have like heart palpitations or a racing pulse, unexplained weight loss. They feel like they're just burning, frequent bowel movements or diarrhea, heat intolerance, excessive sweating, insomnia, tremors, especially like in the hands, and then light or absent periods. Hyperthyroid patients often experience increased adrenergic sensitivity, leading to symptoms that mimic anxiety or panic disorders. This is research out of the New England Journal of Medicine, 2010. And so again, that that heightened, overstimulated feeling can often be related to the thyroid. Now, I really want to kind of dial in on this one because this is what we often see is the most commonly missed diagnosis when it comes to the thyroid, and this is Hashimoto's thyroiditis. Again, this is tricky because the symptoms of thyroid dysfunction don't always stay like in one lane. They often follow different patterns for different people. And so autoimmune thyroid disease like Hashimoto's is often missed because oftentimes it doesn't even present symptoms until it's full blown and causing a thyroid condition. So basically, what is autoimmunity? Real quick, an autoimmune condition is when your immune system is attacking itself. And so in this situation, in particular, the immune system is attacking the thyroid gland. And so this can lead to inflammation, destruction of tissue, and then obviously cause dysfunction of the thyroid. This starts often with episodes of hyperthyroidism, like your thyroid is just dumping hormones, but then it will lead to hypothyroidism as the gland burns out. And so this is critical because up to 90% of all hypothyroid cases in the US are autoimmune Hashimoto's related. Yet many patients are never even tested for antibodies. 90%, I'll just say that again, 90% of all hypothyroid is related to autoimmune Hashimoto's disease. So if you experience symptoms that swing maybe between the hyper and the hypo, which I just talked about, say like 1 month you feel wired, anxious, you're losing a ton of weight. The next month you're exhausted, you're depressed, you're gaining weight. You feel like you're on a roller coaster, it's up and down. This often leads to misdiagnosis because they're not checking enough. They're not looking at these antibodies that are going to show autoimmune. And so there's a study out of the journal Affect Discord that said studies show strong links between autoimmune thyroid disease and depression, bipolar symptoms, and anxiety, especially in women. Yet what's often the first course of action is to put people on antidepressants and medication without actually finding out what's causing it. So this is my perspective here, and I'm going to give you a little insight into what functional medicine really, really takes action on is if your body's attacking your thyroid, it's not just a hormone problem, it's an immune problem. And you can't solve that with Synthroid, which is a synthetic thyroid, because conventional treatment often is just going to give you T4, which is levothyroxine or a Synthroid, without actually addressing what's the immune dysregulation, what nutrient deficiencies might be there. Is there leaky gut or gluten sensitivity? Is there chronic inflammation or infection? And so patients often get like partial relief, or they feel nothing from that medication and their symptoms persist even though the small view of labs that they've taken are normal. And so with the functional medicine view, we're going to listen for these patterns. We're not just going to chase lab numbers. Again, honestly, the labs tell us a lot, but it's not the whole picture either. The patient themselves is the picture. And so we test for autoimmune markers like thyroid peroxidase and anti-thyroglobulin antibodies. We look at the gut thyroid brain axis, looking at things like leaky gut, looking at dysbiosis. Is there any dysfunction in the gut? And we like to explore what are called cofactors. I like to look at the levels of selenium, zinc, iron, vitamin D, and omegas. These all can point to thyroid dysfunction as well, because selenium has been shown to reduce TPO antibodies in Hashimoto's patients and improve thyroid autoimmunity markers. So let's do this. Let's get into the next segment where I want to discuss how we test the thyroid in functional medicine, why that's different and superior to conventional medicine. But first, here's a quick word from one of our sponsors.
This episode of Health Decoded is brought to you by Authentic Nutrition, the brand redefining what it means to fuel your body the right way. At Authentic Nutrition, they believe that what you put into your body matters. That's why every single product is crafted with clean, premium ingredients and dosed with maximum efficacy to ensure you're not just meeting your health goals, you're exceeding them. No fillers, no shortcuts, no gimmicks. Whether it's their advanced supplements for energy, recovery, or gut health, you can trust that what's on the label is exactly what's in the bottle. Authentic Nutrition delivers science-backed formulations that work as hard as you do. If you're tired of products that promise the world but don't deliver, It's time to make the switch to Authentic Nutrition. Elevate your health with transparency, quality, and results you can feel. Check them out today at authenticnutrition.com and use promo code Alessi15 to get 15% off. That's THENTIC nutrition.com, promo code ALESSI15 to save 15% and take the first step toward real, lasting health. Authentic Nutrition. Fuel your best self. Now back to the episode.
Okay, welcome back. Now let's talk about how we test the thyroid in functional medicine. So here's the problem. Most people are told their thyroid is fine when it's actually anything but that. And that's because the conventional medicine approach basically uses an outdated map to read a complex system. If you're only testing TSH and T4, you're missing most of what you actually need. And so in functional medicine, we don't just check the gland itself. We're looking at everything. What is the thyroid connected to? Like the gut, the brain, the immune system, right? We're checking all of that. And so standard care, again, they're going to look at TSH and they're going to look at total or free T4 and maybe T3. This limited snapshot is going to miss the deeper dysfunction if it's there. And so in cases of autoimmune thyroiditis, poor T4 to T3 conversion, high elevated reverse T3, or even chronic stress or nutrient issues, they're going to be missed. There's a study in 2017 in the Frontiers of Endocrinology, and it basically confirmed that TSH alone is insufficient to diagnose thyroid dysfunction. Now, this is a study that was done 8 years ago, and still doctors are on this basic approach of TSH and T4. And so something's wrong with that model. Something's broken there. And we're very passionate about trying to disrupt that conventional way of thinking about medicine and really empower patients to take a more like proactive look. And how do we look at everything that's going on and a more root cause based approach? And so what we test in functional medicine is what we call it's the optimal thyroid panel. And so to understand the full picture, we're going to run a comprehensive thyroid panel that includes TSH. It's going to have free T4 and free T3. We're going to look at reverse T3. We're also going to look at what I believe to be honestly the most important things that no docs are looking for, which is TPO, thyroid peroxidase antibodies, and TG, which is thyroglobulin antibodies. These are direct markers of autoimmune thyroid disease. This is what I found in myself. I had no symptoms. My thyroid hormones were normal. Everything was normal. I ran a full comprehensive thyroid panel and I had massive levels of TPO and TG antibodies. Then I had a stressful event in my life that tipped basically the balance over and the symptoms were off the charts. Like I could not function. My brain was not working. I was anxious. I had all these back and forth swings and it was full blown thyroid autoimmunity. And so I was able to reverse that and actually heal from that over time. It did take time, but with a natural functional medicine approach, lifestyle-based approach, and not to get too much into that, but that just is a great story. And it's super close to home for me because it shows that that conventional approach can miss something until it's too late. And so it's like, why wait until symptoms are full blown to check for things? Let's get ahead of it. That's the proactive approach of functional medicine. And so even beyond that, right, other things we have to look for, and I did this with myself, is looking at the bigger picture. So what is the brain, the immune, and the gut doing? And so because the thyroid is part of this complex system involving the gut, the liver, the adrenal glands, and the immune cells. And so additional functional tests that we're always going to run when it comes to thyroid is things like the leaky gut test or a gut inflammation test. We want to look for zonulin is a marker basically of intestinal permeability, telling us whether or not the gut is permeable and letting undigested proteins and pathogens into the bloodstream that can then be causing autoimmunity. We look for things like lipopolysaccharide antibodies, basically a marker of bacterial endotoxin exposure. This is a major trigger for autoimmune thyroid disease, especially in Hashimoto's. And so on top of that, Food sensitivity testing, looking for IgG and IgA antibody panels. These are often are going to identify delayed immune responses. Some really common triggers we find are things like gluten, dairy, soy, eggs. And then often people have sensitivities to foods that they're not even aware of, and that's slowly causing inflammation and disruption to the gut barrier, which is then causing upstream autoimmune issues. This concept is not isolated to the thyroid, by the way. That's obviously the topic of this podcast, but this is a driver for things like rheumatoid arthritis, psoriatic arthritis, lupus, any type of autoimmune condition has a underlying root cause of gut dysfunction. And so a study out of the American Journal of Gastroenterology in 2000 said gluten sensitivity is strongly linked to thyroid autoimmunity. Up to 50% of Hashimoto's patients have anti-gliadin antibodies, basically like celiac disease type antibodies. And so that just, again, that points to the connection and the bigger picture piece that we really need to see. Now, other things we're going to look for, micronutrient testing. Again, selenium, zinc, iron, B12, and vitamin D. These are essential cofactors for T4 to T3 conversion. So if we're seeing somebody has poor conversion of those hormones, we're going to test these micronutrients. Adrenal function testing. What is cortisol, right? Salivary cortisol or dried urine panels like the Dutch test, which we've discussed in previous episodes, is the adrenal glands, are they dysfunctional, which then can disrupt thyroid conversion and contributes to reverse T3 elevation. And then things like toxin and heavy metal testing, BPA, mercury, lead. These things can interfere with the thyroid hormone receptors, cause those to not bind the thyroid hormone, and thus lead to dysfunction. There was a study out of the Journal of Clinical Endocrinology and Metabolism that showed the environmental impact, right? High BPA levels, which is the BPA is found in plastics. They're linked to altered thyroid hormone levels in both men and women. Now, why does all of this matter? I know I just got really nitty gritty and really detailed, so you may need to listen to this a couple times. But again, the thyroid doesn't act alone. If your doctor is only looking at thyroid numbers and is ignoring your gut, you need a new doctor, because your gut, your stress, your nutrient status, your toxic load are all players in this cascade that can then cause thyroid dysfunction. Functional testing is what helps us identify root causes like chronic stress. Poor liver detoxification. Is your immune hyperactive? Gut dysfunction, or even environmental toxin exposure that's overloading your system. So if you're only looking at the thyroid, you're missing half of the picture. Now, all of that being said, let's talk about how do we heal the thyroid naturally once we've tested, diagnosed, and discovered some type of dysfunction. So again, let's be clear. Thyroid dysfunction, it's not a random event. It's not genetic. My mom had it, so I have it. It's your body it's your body dysfunction telling you something. So the good news is when you remove the stressors or the things that are causing the dysfunction, you rebuild and support from the inside out, your thyroid will bounce back. That's how the body works. Things are meant to heal and recover. And so step one is always we have to remove the triggers. And so we have to stop the thyroid from being attacked or bogged down. So these are often food triggers. Things like gluten is the number one offender, especially in Hashimoto's thyroiditis. It can trigger something called molecular mimicry, where the immune system confuses the gluten proteins for your thyroid tissue. And so now where your immune system's trying to attack those, it starts attacking itself. Even non-celiac patients with a gluten sensitivity are going to have that fueled inflammation. So a gluten-free diet has been shown to reduce thyroid antibodies in Hashimoto patients. Dairy, soy, and refined sugars are also going to spike that immune activity and cause gut permeability. Soy has been shown to inhibit thyroid peroxidase, affecting hormone synthesis. And sugar obviously drives insulin resistance, which can worsen that hormone balance. So removing these foods from the diet, cleaning up, and then avoiding toxins, things like plastics and BPA, heavy metals, pesticides. These are all endocrine disruptors. Avoiding chronically stressful things, So when you have elevated cortisol, you're going to have blockage of that T4 to T3 conversion. It's also going to increase reverse T3, which neutralizes your active thyroid. So that's the lifestyle component. How do we de-stress? How do we put into approach things like breath work, things like using meditation practice or sauna, things where we can get some positive stressors, remove those negative stressors from the body. Now, step two, okay, we've removed the offenders. Step two is now to heal the gut, to rebuilding. And so we always, if we want to heal the thyroid, we have to start with the gut. It's the command center for your immunity. 80% of your immune system lives in your gut. And so a leaky or inflamed gut is a known trigger for autoimmunity. And so how are we going to heal this? Supplements and amino acids like L-glutamine, which actually repairs the gut lining and it fuels those enterocytes. Zinc carnosine protects the mucosal integrity. The mucosa is basically the lining of your gut. Collagen, these peptides are going to restore connective tissue in the GI tract. Probiotics, so we're making sure we're rebalancing the microbiome and reducing inflammation. Another great thing that we use is a peptide called BPC 157, body protection compound. It's basically a gut enzyme peptide that lives in your gut and is responsible for maintaining that integrity of the gut lining. And so these are all things that you can take, but it's not about just taking more stuff. You have to do it in a way that makes sense. And so coming up with a plan and doing it in the appropriate steps. And so step three, now we're going to directly support the thyroid function using essential nutrients like selenium, which is going to reduce those TPO antibodies and support the conversion of T4 to T3. Zinc is critical for T3 receptor function. Vitamin B12 for methylation and cellular energy. Tyrosine and iodine. Iodine is required for hormone synthesis. Very important. Now, some other cooler, more fringe things that we use are things like adaptogenic herbs. Ashwagandha is an awesome adaptogen. It balances your stress hormones and it's going to support thyroid hormone production. So basically, if you have elevated cortisol, ashwagandha can help lower it. And if you have low cortisol, ashwagandha can help elevate it. That's the cool part about these adaptogens is they bring balance to the system. Rhodiola rosea is an adaptogen that enhances resilience to stress as well, and it can boost mitochondrial energy. And then if necessary, this is something that we use as well, are things like low-dose thyroid medication. If we need things like NDT or natural desiccated thyroid, or even low-dose T3, we can prescribe these and build them in, but often we're going to use these for a period of time and then phase off of that. That's not a long-term approach, but sometimes can be necessary on the front end. Now, step 4 is modulating the immune system, making sure the immune system is functioning properly, but not overactively in autoimmunity. And so the diet we often prescribe is what we call the autoimmune protocol, the AIP diet. This removes common triggers while also flooding the body with nutrients. It's very whole food focused, focuses on meat, fish, vegetables, fruits, fermented foods, and healing fats. And so a study out of the Inflammation Bowel Disease Journal in 2017 showed clinical trial data shows that the AIP diet can significantly improve autoimmune symptoms and quality of life. And so that is often going to be the diet I recommend people be on and long term. It's a diet I follow myself. It's easy to do. It's whole food based and it's simple, really. Now, also lifestyle plays into this. We always talk about what is lifestyle medicine. So prioritizing restorative sleep, daily movement, stress regulation techniques like breath work, prayer, time in nature. And then oftentimes we can take it a step further and get a little bit more advanced with some of the therapies we use when needed. Things like that low dose naltrexone, which modulates the immune system. This is something I kind of cycle in and off of myself. Peptide therapy like thymosin alpha 1 or BPC, and immune modulators. These are targeted natural or pharmaceutical options based on immune testing, obviously. And so Here's a bonus step, something that you can do that is going to benefit your mitochondria and your hormones, and basically supporting your cellular energy from the inside. So using nutrients like CoQ10, acetyl L-carnitine, magnesium, alpha lipoic acid. These are going to fuel the mitochondria, which then improves hormone production and energy output. Go listen to our episode on mitochondria, and there's a lot more on what I just talked about. And then obviously we need to balance the other hormones as well. So cortisol, making sure there's not too much or too little, because this can block thyroid conversion. Estrogen and progesterone, imbalance in these can worsen thyroid symptoms and autoimmunity. Hormone balance is achieved through lifestyle, making sure we're testing specific herbs and nutraceuticals, and then bioidenticals if necessary. And so the takeaway here is that thyroid dysfunction is not in isolation. Testing will show us what's actually going on and where are the downstream systems that are being affected. And then how do we implement a plan that takes a stepwise approach? It's a system, it's a protocol that does one thing at a time, not just throwing the kitchen sink at it, and heals the thyroid for good, because you can have complete remission of these type things if you do it correctly. Now, when you do that, you're going to have more energy. You're going to have reversive symptoms like hair growing back, mood lifting, metabolism resetting. This is what true healing looks like and what is achievable with functional medicine. Now, if you've ever been told that your labs are normal, but you don't feel normal, you need to explore deeper, and you need to be a proponent for yourself, take action, and figure out what's going on. So I'll challenge you to do this. Go to alessifunctionalhealth.com and take our free thyroid quiz. Go under the resources tab and find quizzes. Our free thyroid quiz to see if you have any of these symptoms or may be at risk for a deeper thyroid issue. Now, to learn more about how we help diagnose, reverse, and heal thyroid dysfunction and autoimmunity within our functional medicine programs, go to alessifunctionalhealth.com, schedule a consultation with me or one of our providers, and let's create a personalized plan for lifelong health. Listeners of this podcast will always get exclusive discounts and price reductions on all of our protocols, lab tests, and other treatments. So be sure to mention where you heard about us. As always, if you found value in today's show, please smash the subscribe button, and share this episode with someone who needs to hear it. That's the only way we grow, and the only way this message can get out there and change more lives. If you want to get in touch with us or be featured on an episode and share your story, email us your questions or your story at ask, that's ASK, at alessifxhealth.com. Visit alessifxhealth.com, sign up for our newsletter, check out our resources page, and learn more about our approach to nutrition and cutting-edge therapies. Thank you again for tuning into Health Decoded, where we break down the science, bust the myths, and help you take control of your health naturally. Until next time, stay curious, stay empowered, and remember that your health is in your hands.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask at alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.